So we decided to do our interview with Professor Scott. Professor Scott,
Hello.
based on your experience, how has hospital-acquired infections impacted the patient outcomes and nursing duties?
Hospital-acquired infections have definitely impacted patient outcomes, because when patients come in for something routine and then they get a hospital-acquired infection, it typically increases their length of stay. They do worse overall. The hospital ends up not getting reimbursed for all that extra care, so the hospital takes a big cut. I guess eventually if the hospital's doing poorly, then there could be layoffs and other things like that. So hospital-acquired infections are something that it's pushed into us to try and prevent and to try and avoid throughout their hospitalization. So.
And how difficult is it to keep your patients and the environment clean 24/7 when you're not with them?
It's hard. They do this thing called foam in, foam out. So always washing your hands going in and out of the rooms. If you're, a lot of patients, they'll do different cultures. They'll swab their nose looking for MRSA, things like that. If they are, they don't really have an active infection, but it's considered a colonization. So we put them on isolation. So that takes more time, putting on the gown and the gloves and all that kind of stuff. So infection is a big thing trying to prevent, because there again, that goes back to your question. If we're not preventing it in the hospital, then we're going to transmit it to another patient. Students always wonder about getting it themselves. I mean, I've been doing this for 30 years and I've never gotten an infection from a patient because I'm not immunocompromised, but other patients in the facility are, so that's who we're really trying to protect, them more so than ourselves. That answer your question?
How have you been successful in preventing these types of infections from occurring within your own patient population?
I think mainly a lot of these things are central line infections, urinary tract infections, bloodstream infections, surgical site infections. So if you, and a lot of this boils down to nursing care. So if you do what you're supposed to do, you don't cut corners, you maintain a sterile field or a sterile environment. There's, when we take our students in their junior, we teach them a lot of these skills, and that's my thing. If you're the only one in the room and nobody sees you contaminate something, don't just keep on doing the procedure. Stop. Go get another kit and do it right, because that's how these things happen. So I think it's an ethical duty, and it's just a good thing to maintain that sterile field, maintain your sterility when you're doing a particular procedure. If you see a dressing that, like on a central line, that's coming off, then replace it. Don't just tape over it, but put a new one out there. Don't contaminate the IV sites. We always talk about scrub the hub. Now we have these little caps that we put on. Just making sure you do it right and not contaminating things, because I find that does happen. People cut corners, and that's just bad.
That kind of brings us to our next question. What type of action are nursing instructors taking to help educate future nurses about this issue?
I get on my soapbox a lot, because when I'm teaching the students, I'm really about, I always tell them, if you go in and part of your assessment is not only assessing your patient, but it's assessing the entire environment. And many times they'll walk in a room and something's not right. And I'll say, well, what are you going to do about that? And students are timid. They're not 100% sure of themselves, so they don't want to, they think, well, because the nurse left it that way, it must be okay. And I'm like, well, if it's wrong, fix it. You can't just leave it and pass it to the next shift. So I really try and empower the students to do the right thing, and if it's wrong, to fix it and make it right. Don't just leave it for the next shift.
And for the final question, looking forward, what advice would you give to your current nursing students regarding hospital-acquired infections?
pretty much the same. I think it all kind of fits. As you know, I don't care if you were the one that left the tubing that way, or if you were the one, if you came in and found it that way, then don't reuse it. You know, if it's contaminated, go get a new one. Don't settle for the status quo. And there was a critical care conference that I'd gone to, and it was about, I can't remember exactly what the thing, but the huge push was sepsis and preventing infections and these kind of things. And they were saying, like, students and new nurses and people just in general need to speak up. If you see something wrong, just because a nurse has been there 30 years doesn't mean they're doing it right. Or if a physician comes in and they contaminate something, you need to speak up. So they had a campaign. They had these buttons. It was like, it's hard to speak up when you're not comfortable because you don't want to confront somebody if you don't feel it. But if you go up to them and say, "Dude, what's wrong?" You know. So it was the dude campaign. So you know you can go up and say, "Dude," you know, and you're not really pointing them out, but you kind of are in that sense. So I thought that was kind of a clever way because it does give people, they feel like they could say that versus going up and saying, "Excuse me, sir, did you realize that you just dropped that on the floor and you read it?" You know, person
Right.
can go, "Dude,"
More approachable.
you know, a little bit different. So I encourage people to speak up if they see something wrong.
Okay.
All right.
Thank you so much.
You're welcome.
Yay, we had a hard time.